Welcome and thank you for joining me for 30 minutes on Medicare Basics today. My name is Joseph Budd and I'm a certified financial planner and managing partner with Budd Wealth Management. We have developed and refined our client life process over the last 20 years to work with families that aspire to a work optional lifestyle. We hope to put all the pieces of the financial puzzle together for our clients. Also visit us at budwealth.com. Today's session is being recorded and you'll receive a copy of the recording in a follow-up email. Welcome again, and over the next half hour or so we're going to talk about some of the things you need to know about healthcare when planning your retirement. Okay, let's begin with the most basic of basics. What is Medicare? Everyone over 65 is eligible for Medicare. This includes all U.S. citizens, legal residents who have lived in the U.S. continuously for at least 5 years, some people under 65 who can get Medicare if they receive Social Security disability benefits. Our discussion today will pertain to the first group, people over 65. Medicare is divided into 4 parts. Part A covers part of the costs of hospitalizations. Part B covers part of the costs of medical services such as doctor's visits, procedures, and diagnostic tests. The bills for Parts A and B are paid by Medicare. Parts C and D are where the private insurance comes in. Part C is an alternative way to get Medicare. You can sign up for a Medicare Advantage plan offered by a private insurer and get all your services under Parts A and B, and usually prescription drug coverage as well through the plan. Instead of Medicare paying for your hospital and your doctor's bill, it pays the insurance company offering the Medicare Advantage plan a flat payment for each enrollee, if the plan is responsible for managing and coordinating your care. Part D is prescription drug coverage. It is offered by private insurers who contract with Medicare. Each prescription drug plan is slightly different, which is why you'll want to shop carefully for your drug plan. Even if you don't take any prescription drugs when you first go on Medicare, you'll want to sign up for a Part D drug plan, because if you go without drug coverage for very long, you'll face a penalty when you finally do enroll. This image shows 2 ways to have Medicare. If you go with the original Medicare, you sign up for Parts A and B. Then you decide if you want prescription drug coverage under Part D. This shows drug coverage is optional, but it can be dangerous to go without drug coverage, so we're recommending that everyone plan to have some kind of prescription drug coverage starting from the onset of Medicare. In Step 3, you decide if you want supplemental coverage. Again, Medicare shows this as optional, but we think it's pretty important because Medicare leaves too many gaps. The second way to get Medicare is through a Medicare Advantage plan offered by a private insurance company. There are many companies in this area offering Medicare Advantage plans, so if you go this route, it will be important to shop for plans and find ones that meet your needs. And again, drug coverage is shown as optional, but we would recommend that you choose a Medicare Advantage plan that offers prescription drug coverage. Choosing how to take Medicare is a big decision. It needs to be individualized, and we can't go in depth here today. We can get you around certain pitfalls though. And that's basically a question of enrolling on time. Here are the fundamentals of Medicare enrollment. This is the main principle. Unless you're covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. What if you don't enroll in Medicare on time? The consequences are pretty dire. First, you'll be charged a late enrollment penalty, and the longer you go without enrolling, the higher the penalty will be, and it will continue for the rest of your life. The second consequence is that your health care expenses may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. If you have other insurance, it will not pay its share until Medicare pays its share. So if you don't have Medicare, you could end up getting stuck for the whole bill. And finally, Your private insurance options may be limited. If you're in poor health and have a pre-existing condition, the private insurers that coordinate with Medicare have to take you if you sign up for Medicare during your enrollment period. But if you don't and you apply for Medicare insurance later or private insurance later, you may not be able to get insurance and you may be charged a higher premium. If you are receiving Social Security when you turn 65, you will automatically be enrolled in Parts A and B. If you're working and covered by an employer group plan, you may not want Part B. In that case, you can decline it. Otherwise, you'll go ahead and accept Parts A and B, and your coverage will start on the first day of the month you turn 65. Parts C and D are not automatic. If you want a Medicare Advantage plan, you have to contact the insurance company offering it and sign up for Part C through them. Or if you want to stay with original Medicare and have a standalone Part D prescription drug plan, you'll want to decide which insurance company's plan you want to go with, and you'll have to proactively enroll. You should do this at the time you are enrolled in Parts A and B before your 65th birthday. What if you're not receiving Social Security when you turn 65? More and more people are continuing to work or at least delaying the start of Social Security in order to receive a higher benefit. In this case, you'll need to proactively enroll in Medicare during the Medicare enrollment period. There are three main Medicare enrollment periods. The initial enrollment period applies if you are not covered by a group plan that covers 20 or more employees when you turn 65. If you're covered by an employer group plan because you and your spouse are still working, you have a special enrollment period, which I'll explain in a moment. If you miss either one of these enrollment periods, you can sign up for Medicare during the general enrollment period. The initial enrollment period for people who aren't covered by a group plan at 65 starts 3 months before you turn 65 and lasts until 3 months after you turn 65. But although it lasts a total of 7 months, you really should plan to enroll in Medicare during that 3-month period before you turn 65. Then your Medicare coverage will start on the first day of the month you turn 65. By the way, if your birthday happens to be on the first day of the month, everything is moved up a month. Just pretend your birthday is in the previous month. For example, if your birthday is June 1st, your initial enrollment period would start February 1st, and if you sign up during February, March, or April, your coverage would start May 1st. We've been talking about signing up for Medicare as a whole, but there are times when we need to break it into parts. Most people will sign up for everything all at once, but there may be times when you want to sign up for some parts and not others. If you're still working when you turn 65, check with your benefit administrator to see if you should sign up for Part A. We mentioned earlier that if you are covered by an employer plan, when you turn 65, you have a special enrollment period that comes later. However, you may want to sign up for Part A when you first become eligible for it at age 65. The reason is that it may offer better coverage for hospitalization than your employer group plan. And Part A is usually free to you, but check with your benefits administrator anyway. If your employer group plan is a high deductible health plan paired with a health savings account, and if you want to keep contributing to the health savings account, you should not sign up for Part A. The reason is that once you enroll in Medicare, your HSA contributions must stop. But let me be clear, if you have an HSA and your employer plan covers fewer than 20 employees, you will have to drop the HSA and sign up for Medicare during your initial enrollment period at 65. If you're not covered by an employer group plan when you turn 65, you want to sign up for Part B during your initial enrollment period, preferably that 3-month period before your 65th birthday. So if you're not working, if you're self-employed, if you're employed by a company that has fewer than 20 employees, if you're on COBRA, even if you're receiving retiree health benefits, you'll want to sign up for Parts A and B during your initial enrollment period. If you signed up for Parts A and B during your initial enrollment period, and if you think you will ever in your life want prescription drug coverage, you should enroll in Part D at the same time. If you go more than 63 days without credible prescription drug coverage, you will pay a late enrollment penalty when you finally do sign up for Part D. So it's better just to go ahead and get your drug coverage from the onset, even if you aren't currently taking any prescription drugs. As mentioned before, you have two options. You can enroll in the standalone prescription drug plan if you have original Medicare, or if you can get your drug coverage through a Medicare Advantage plan. Okay, that takes care of the initial enrollment period. Now we're going to talk about the special enrollment period. This is for people who are covered by an employer group plan that covers 20 or more employees when they turn 65. In this case, you will not be penalized for not enrolling in Medicare at 65, but you will be penalized if you don't sign up during your special enrollment period. The best time to sign up is before your current coverage ends. That way you have no gaps in coverage. But you actually have a grace period of several months to avoid late enrollment penalties. For Part B, that grace period starts the month your coverage ends and lasts for 8 months. For Part D, it only lasts 63 days. To summarize, you can avoid late enrollment penalties by signing up for Medicare during your initial or special enrollment period. But to avoid gaps in coverage, which is even more important, you should sign up before your current coverage ends. What if nobody ever told you about the Medicare enrollment periods and you didn't sign up when you were supposed to? Well, you can still sign up, but now you have to do it during Medicare's general enrollment period, which runs from January 1st through March 31st each year. This is the only time you can sign up for Medicare if you are outside of your initial or special enrollment period. Coverage starts the month after you enroll. So as you can see, this could leave you with some coverage gaps, so you really want to avoid having to sign up during the general enrollment period. But it may be the only option for some people. The important thing to know is you just can't sign up for Medicare as soon as you realize you failed to do so. If you're outside the general enrollment period, you have to wait until the next one rolls around. Okay, let's do a quick review of Medicare enrollment periods because this is important. The initial enrollment period is for everyone age 65 who is not covered by an employer group plan that covers 20 or more employees. The best time to sign up is 3 months before your 65th birthday, and Medicare coverage will start on the first of the month you turn 65. Special enrollment period is for everyone over 65 who is covered by as a current worker or a spouse of a current worker under an employer plan that covers 20 or more employees. The best time to enroll in Medicare is before that coverage ends. Then your Medicare coverage will start on the first of the month of enrollment. The general enrollment period is for people who did not attend this presentation and didn't know when they needed to sign up for Medicare during their initial or special enrollment periods. They can sign up between January 1st and March 31st of each year, with coverage starting the month after you enroll. How do you sign up for Parts A and B? It's very easy. As I mentioned, you are already receiving Social Security. When you turn 65, you'll be automatically enrolled in Medicare. If not, you can go to ssa.gov, click on Medicare, and click on the big Apply for Medicare Benefits button. Or you can do it by phone by calling Social Security at 800-772-1213. Part D isn't quite as straightforward because first you have to decide how you want your prescription drug coverage, whether you want a standalone prescription drug plan or a Medicare Advantage plan. In either case, you'll be shopping for plans offered by private insurers. Once you've decided on original Medicare versus Medicare Advantage, and then chosen the specific plan, you can enroll in Part D through the insurance company or through Medicare. And this brings us to Part 2, Medicare and private insurance. Focusing on the out-of-pocket costs paid by Medicare beneficiaries, they fall into two main categories: premiums and out-of-pocket costs. Monthly premiums are paid to Medicare and the private insurance companies offering the drug plans and Medigap policies, or the Medicare Advantage plan. Out-of-pocket costs include deductibles, the portion of the doctor bills not paid by Medicare, and the services not covered by Medicare. First, let's look at the monthly premiums. Part A is free if you and your spouse have paid into Medicare over 10 years. This is one reason most people sign up for Part A when they turn 65, even if they're covered by an employer plan. It doesn't cost anything. Part B is different. It costs $185 a month in 2025. The Part B premium is adjusted for inflation, so it might be higher next year. Also, higher income beneficiaries will pay more. The Part B premium is paid to Medicare. Part D premiums vary depending on which plan you choose. The Part D premium is paid to the private insurance company whose drug plan you choose. This table shows the Part B and D premiums for different income levels. If you're single and your income is under $106,000, or if you're married and your income is under $212,000, you will pay the regular Part B premium of $185 a month. There will be no income-related adjustment. If your income falls into one of these other tiers, you will pay an income-related adjustment on top of the base premium. For example, if you're in the second tier, you'll pay an extra $74 for Part B and $13.70 for Part D on top of your regular premiums. This will bring your total up to $272.70 per month. Keep in mind that these are per person, so if you are a couple, you can double those amounts. Your tax return from 2 years ago is used to determine this income-related adjustment. For example, the adjustment for 2025 will be based on the income you reported on your 2023 return. And keep in mind that the premiums shown here do not include premiums for drug plans, Medicare Supplement, or Medicare Advantage plans. This is for Part B and D only. In addition to premiums, there will be some other out-of-pocket costs under Medicare. If you have to be hospitalized, the first $1,676 in hospital costs will come out of your own pocket before Medicare starts paying. Some private insurance plans cover this as well. We'll see in a minute. Part B's deductible is a reasonable $257 per year, and this is waived for some preventive services such as flu shots and certain screenings. Part D deductible is $590 per year under the standard Medicare design, but Part D coverage is quite complicated, and as we'll see in a minute. After you've met your deductibles, there are some other costs. Medicare doesn't pay your entire medical bill. If your hospital stay exceeds 60 days, you'll be responsible for $419 a day up to the 90th day, and then $838 per day up to the 150th day. And after that, you'll pay the full cost. Medicare pays the full cost of 20 days of skilled nursing care. And after that, you'll pay $209.50 per day for days 21 to 100. If you need more than 100 days of skilled nursing, you'll pay the full cost. As for Part B, your responsibility is 20% of the Medicare-approved cost. Doctors who accept assignment agree to be paid directly by Medicare and will not bill you any more than the Medicare-approved amount. Doctors who don't accept assignment may charge more. If they don't charge more than 15% over the approved amount, Medicare will pay 80% of the Medicare approved amount, and you'll be responsible for the rest, the 20% plus the 15% over. Under the standard drug plan design, the beneficiary pays $590 deductible, then 25% of drug costs after that deductible have been paid. Once out-of-pocket spending has reached $2,000, there will be no further cost for your covered drugs. The $2,000 cap is new this year and part of the Inflation Reduction Act passed in 2022. But Drug plans vary widely. Some will pay more, requiring you to pay less. It will be important to find a plan that covers the drugs you take. After looking at all those out-of-pocket costs that you have to pay, you might be wondering what Medicare does cover. Well, it covers the first 60 days of hospitalization minus the deductible, of course. It covers 80% of your doctor's bills, and it covers some preventative services. The best reference for finding out what Medicare covers is the Medicare and You book. To get it, you can call 800-663-4227 or go to medicare.gov. The Medicare and You book spends over 20 pages talking about what Medicare covers, and only one page talking about what it doesn't cover. I'm not talking about partial payments, I'm talking about no coverage whatsoever. For the list of services you see here, now some of these things you can avoid. Cosmetic surgery is optional, for example. If you never go outside the US, you don't have to worry about that. But some things and other things may be necessary. Dental work, eyeglasses, hearing aids, these are all things you'll have to cover yourself. This is where private insurance comes into play. Private insurance can cover all or part of your deductibles, those hospital costs after 60 days, and the 20% of doctor's bills that Medicare doesn't pay. And of course, all prescription drug coverage is offered through private insurers who contract with Medicare. Medicare alone doesn't cover them. Depending on the drug plan you choose, it may cover the deductible, and it should cover most of the cost of certain drugs during the initial benefit period and the catastrophic coverage period. But it won't cover all things. Each plan has its own list of drugs called a formulary. Medicare supplement coverage, commonly called Medigap policies, are issued by private insurance companies and are designed to fill in the gaps that Medicare doesn't cover. Although they are not affiliated with Medicare, they do have to follow certain federal and state laws designed to protect you. Medigap insurance policies are standardized. They're identified by the letters A through N. So if you buy a Plan G in California, it will offer the same benefits as the Plan G in New York. However, the premiums can vary considerably from company to company and from area to area. That's why it's so important for you to carefully evaluate Medigap insurance and not pay too much for it. We don't have time to go into depth here. You'll have to do your own research to determine which Medigap policy works for you. If you'd like, I can help you with this or direct you to a professional who can. Medicare Advantage plans, also called Part C, are offered through private insurance companies that contract with Medicare. Medicare pays an amount to the plan for each member's care, and the plan is responsible for providing the care. You may have to use the network's doctors and hospitals. You'll want a plan that includes prescription drug coverage, and you may even be able to get extra benefits like vision care. But the benefits and cost sharing for Medicare Advantage plans are different than the original Medicare. So again, you'll need to shop carefully and choose a plan that fits your needs. And this is just a reminder once again to shop carefully for private insurance. Medigap policies are standardized, but the premiums vary considerably. First, choose a plan that offers the coverage you need. Plan F is the most comprehensive plan. Then choose a reputable company offering that policy at the lowest price. Before signing up, check with your provider's billing department to make sure they process the billing for the company you choose. Otherwise, you'll have to pay the bills yourself and then file a claim to get reimbursed by the insurance company. You don't want that. As a wrap-up, we're going to talk briefly about overall healthcare costs. You do not want to get into the weeds here, but if you are to have a realistic understanding of the challenges of building a retirement healthcare budget, we have to go over some basics. What can cause your healthcare budget to change? Two things: inflation and the possibility of getting sick. As healthcare costs continue to rise, insurance premiums go up and the non-covered services that you pay for yourself get more expensive. If you get sick, you may need more expensive prescription drugs, and have to spend so much that you find yourself in the donut hole, having to pay many thousands of dollars a year for your medications. And there's always the possibility that as you age, you'll require more non-covered services, like major dental work, hearing aids, and long-term care. How can you plan for rising healthcare costs when you might be on a fixed income when you retire? One way is to set aside enough funds to cover your future healthcare costs before you retire. Fidelity does a study every year to determine how much the average couple might need at the start of retirement to fund all their future healthcare costs, not including long-term care. They say the average couple will need about $315,000. The Employee Benefit Research Institute did a similar study with a slightly different variable and came up with $142,000 for men, $159,000 for women, and $296,000 for couples. How many of you know someone that got old and needed long-term care? We're not necessarily talking about nursing home care. Long-term care can range from someone coming to the home a few hours a week to help with meal preparation to skilled nursing care. The important thing to know is that Medicare and Medigap do not cover long-term care. The most comprehensive Medigap policy pays for 100 days of skilled nursing care only. But if you're not sick enough for skilled nursing care, then they're not going to pay for it. The average period of skilled nursing care is just 28 days. And when it comes to custodial care for help with activities of daily living, there is no coverage at all. How much does long-term care cost? Well, it varies with the type of care, of course. The Genworth Annual Cost of Care Survey shows us the median costs across the United States. Homemaker services cost at $189 a day, and home health aid services about $207 a day. Adult daycare costs about $95 a day on average. However, it can range from $30 to $160 a day. Residents in an assisted living facility can range from $3,000 to $7,000 a month depending on location and amenities. The median monthly rate is about $5,000 per month. The most expensive type of care, of course, is a nursing home where residents get skilled nursing care. A private room ranges from $200 a day to $1,200 a day. The median daily rate is $320. 1 year at this rate, and you're spending over $100,000. None of us want to think about getting old and needing long-term care, but there are some very compelling reasons why we need to. One is to spare your kids and other family members the burden of taking care of you. They might not mind doing your shopping or paying your bills, but if you need constant supervision or help with bathing and dressing, that's beyond the call of duty for even the most devoted son or daughter. Another reason to plan for long-term care is to avoid having to spend down assets in order to qualify for Medicaid. This state-run welfare program will pay for your care if you don't have any money. But that's the point. You have to spend down all of your assets to less than $2,000 to qualify, essentially leaving yourself destitute. People on Medicaid don't have a lot of choices about the kinds of care they receive, and this is another reason to plan for your own long-term care, to be able to direct your own care and obtain the kind and quality of care that you want. When you're paying for it out of funds you set aside for this purpose, or when you have insurance that is paying for it, you can decide how you will be cared for, whether it's in your own home or an assisted living facility of your choosing. There's a lot more to say about planning for long-term care, but our time is nearly up. So I'll leave you with 3 reminders that relate back to the 3 key points I talked about at the beginning of this presentation. Reminder number 1 is to enroll in Medicare on time. Know which enrollment period applies to you, whether you need to sign up at 65 or can wait till your employer group coverage ends, and enroll when you need to in order to avoid penalties and coverage gaps. Reminder 2 is to shop carefully for private insurance to go with Medicare. Evaluate all your options and choose the drug plan, Medigap policy, or Medicare Advantage plan that offers the coverage you need at the price you can afford. Don't be one of those people who pay too much for private insurance because they didn't know any better. And finally, plan now for higher healthcare costs in retirement. We know healthcare expenses will be higher than they are today. So when you're planning for your retirement and figuring out how much savings you need to make your money last, be sure to factor in an extra amount for healthcare. You'll be very glad you did. And here are some resources from today that you'll receive in a link in our follow-up email. I hope that you found this content today helpful. I look forward to seeing you at future events. Thanks for attending today and have a great day.